You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us we have Virginia's go-to implant dentist, Dr. Adam Hogan. Dr. Hogan, welcome to the program.
Thank you for having me here today, Randy.
Now, I know you brought a stack of photos, so we're going to try to get to as many of those as possible. But for people that don't know your practice, like who's the typical dental implant patient?
Well, the typical dental implant patient typically falls into one of three categories. One, they've been wearing a denture and they're not happy with the denture. Loose fitting, they can't eat, they don't have confidence, they want something more secure.
Okay.
Two, people that maybe have bacterial infections and they might think they're headed towards a denture and they don't want to get into a denture, and we can prevent that from happening. We can go straight to the implants with teeth. And the third patient is the patient who has been to the dentist year after year after year. They have all their teeth, but every year it's another, so many $1,000s, crowns, root canals, and they're never getting ahead. Before they get done with one tooth, something else is breaking, and they just keep going back, and they're frustrated.
Now, everything that we talk about today, when it comes to dental implants, you teach dentists from all over the country.
Oh, yeah.
Is that right? We have a training institute?
Absolutely. It's called the Atlantic Implant Institute. It's in Virginia Beach, Virginia. We host classes there on full mouth reconstruction, dentists call it, but it's making teeth from start to finish digitally and in different workflows. We can talk about that later. But dentists fly in from all over the country in Canada, and it's been a really great venture. We love sharing the knowledge. And I put it like this, Randy. If I can treat only 20 or 30 people a month, but I could train 20 or 30 dentists how to do it, can you imagine the numbers of people out there who are getting the help that they need all through our center here at the Atlantic Implant Institute?
Now, because you train other dentists and you've got a big implant center, does it cost more to go to a guy like you?
Randy, it actually doesn't, because you're getting it done right the first time. And yeah.
Okay. Now, correct me if I'm wrong. The way dental implant dentistry is typically done, you go to one doctor that does the surgery, another doctor that puts the teeth on top, and then get them maintained elsewhere.
Right.
At your office, you do all of those parts. Is that why you do it faster?
Oh, absolutely. We do it faster, and I'd say we actually do it more affordably too, because you don't have to shop around. It's really confusing for the person looking to get new teeth. They've got to get a price from one, then two, then three, then they've got to run all the way around town. We can do it all in one office, one location, for one cheap price.
Is this true, by the way, that when they're there sometimes, you're printing like a digital printer and a mill, making the teeth in the other room?
Absolutely true. And that's a tremendous benefit that patients need to understand. The average dentist is sending this out to a laboratory somewhere across the country, or maybe even overseas. It might take them 3 weeks to get teeth back. But in our building, we have a laboratory making teeth right there, same day. In fact, we love it because new patients can come in and they can see the laboratory and they can talk to other patients that are having this done at all these various stages of the treatment, and it's wonderful for them to be able to see them all doing this painlessly and efficiently.
Okay, good. Now you brought photos. Let's take a look at what you got.
All right. Well, first of all, every picture that I brought you, every patient that I brought you, was somebody who was wearing a denture or in fear of having to wear a denture. Maybe they had a bacterial infection and they were going to lose all their teeth.
Okay.
So let me get to the first one.
All right.
So this exceptional patient that we have here, she had tetracycline staining on her teeth, and it was really terrible for her. As a young kid, 6 years old, her teeth were off color, and she never liked her smile her whole life. But now she presents to us, and she's worried that she's going to lose her teeth. And she, of course, wants something that looks better. So we were able, with our patient here, to give her a set of upper and lower teeth, all supported by dental implants, and she never had to wear a denture.
Let's take a look.
Here's our after picture. Now, Randy,
Very
I want you to
nice.
pay attention to that lipstick.
Okay, why?
The funny story here. So when we went to give her teeth, she had a makeup bag out. She had 15 or 20 shades of lipstick in it. And I said, "What are you doing?" She said, I'm getting ready to wear lipstick for really the first time. I said, "Really?" She said, "My whole life, I have not been able to wear lipstick because I didn't want to call attention to my mouth and my off-colored teeth.
Right?
I wanted to hide it." And she says, "I have never been able to wear the lipstick." And it brought a little tear to my eye because I'm always shocked about the little things in life that people without teeth can't do to live like the rest of us do.
Okay.
So we put on her lipstick, her teeth, we put her teeth in, she grabbed that hot pink lipstick and she put it on and she blew herself a kiss and she was so happy. And you know what's the best thing about that?
What?
That sparkle in her eye. When she looked at herself and she saw, you don't see it in the before picture. Now, Randy, put those pictures side by side.
Okay.
All right. Would you say that she looks a little bit younger?
Yes.
Would you say she looks a little bit more sophisticated?
Yes. Yes.
Would you say she looks a little happier?
For sure.
Now, take a look at her lip. Take a look at her smile. Do you see how those teeth follow the lower curvature of her lip? Mm-hmm. That is all on purpose. That's all by design. We do that right here in our office. We make those teeth longer. We make them follow her lip. She looks more youthful, and she feels better about herself.
Now, what does she like more? The way it looks or what she could eat? Or is it a combination of both?
Well, she absolutely loves the way she looks. I mean, she can eat anything though. You know, for her, she was afraid of losing her teeth and she had to do something to prevent herself from being in a denture. But she loves the way that she looks. But we're going to look at some other people that
Let's take a look. Let's take a look.
So here's a patient that came in. Gentleman was a little quiet, a little reserved, and he said, you know, I want to get my teeth replaced. I'm afraid I'm going to lose my teeth and I don't want to wear a denture. And so we brought him in. We gave him upper and lower set of teeth, all supported by dental implants. Never had to wear the denture. We totally skipped the denture. But this gentleman that was a nice guy, very well reserved when he came in. You know, he first said, you know, I just want to be able to eat. He's missing his two front teeth. There's a lot of foods you can't eat when you're missing your two front teeth. Anything that you grab with your hand and have to pull. Apples, corn on the cobs, sandwiches. I remember he mentioned sandwiches specifically. He couldn't eat a sandwich in partial.
So when you have bad teeth, you can't eat sandwiches sometimes.
No, you can't.
Right?
If you don't have front teeth, it's hard to bite into anything and tear it and pull it. So he had a partial denture, and it didn't really look the greatest, but it definitely didn't eat well. He couldn't take an apple or corn on the cob and bite into it. So we thought we were giving him teeth just to bite with, just to eat with. But when we gave him his teeth, I want you to take a look at this after picture.
Very nice.
He got way more than he thought he was going to get. He looked at that and, you know, this strong, successful man, good businessman, good family man, you know, never held back, never made an excuse for his front two teeth, nothing. This strong, successful man, he got a little misty-eyed. He said, and that's what he told me. He said, I haven't had my front two teeth since I was 10 or 12 years old. He got knocked out with a baseball or a baseball bat or something like that. And he went through his whole life without his front two teeth. And you wouldn't even realize the difference that made. Look at his before picture there, Randy. He's grimacing. He doesn't even know how to.
Like it's not a real smile.
He doesn't know how to smile.
Okay.
He's never smiled before in his life. Look at him here. He's got a little gentle smile in the after picture. Imagine how big that smile is going to be after somebody gives him 30 or 40 or 50 compliments.
They start growing their smiles gets bigger.
It's going to get bigger. Yeah, absolutely. Go ear to ear.
You say they all have regrets.
Oh, absolutely. This gentleman, like so many of these other patients here, they say their number one regret or their only regret is that they didn't call us sooner.
So all of these patients are numbed up, obviously.
Oh, yes.
What type of sedation? So you're doing sedation on every one of these patients?
Absolutely. We're doing sedation. They're not only numb, but they're going to sleep. So they can just comfortably rest through the entire procedure, and they don't have any memory of it at all.
Now, is this true? Because we're talking about denture wearers, that on the day of the procedure, they can walk in with no teeth and walk out that same day with upper and lower teeth that don't come out.
Absolutely true.
Is that rare?
No, it's not rare at all. We have a laboratory right there for you, so we can turn these teeth around in hours or a day. Most places, they send out that lab work and get it back days or weeks later. But our team is right there. We do this every single day.
You do more, I've been told. Dr. Morales said that you do more in like a week than most guys do in a year.
Oh, absolutely. The average dentist in their career might do less than 5 of these in their career, or maybe less than 2 or 3 a year. We're doing 2 or 3 a day in our office.
Good.
Yeah. In fact, I have a patient I can show you.
All right.
That traveled in to see us. This is one of our typical patients here.
Wow.
You'll notice that he doesn't have any teeth in his mouth. That's not for lack of trying. He did have several sets of dentures made, and none of them were fitting comfortably. He was traveling. He had gone to Maryland, Baltimore, looking for a dentist that could do this. Tried for years. He had been to other places, and he heard about us, and he came into Virginia all the way from the island of Anguilla. So this patient, his options, he had no teeth. His options are just dentures, and he had tried dentures, couldn't wear them, too painful. So he came to see us to see if we could place implants. So for him, we did upper and lower, complete set of dental implants, and new teeth right there, all the way from the island of Anguilla to Virginia, and you can see him right there. Now, one thing that's interesting about that after picture, Randy, he's not fully smiling yet. He hasn't fully realized how to smile or that it's okay to smile. But I'm sure if I were to take a picture of him to this day, a year or two later in Anguilla, he'd be smiling ear to ear.
So he couldn't really eat before, obviously when you have no teeth.
Oh no, he couldn't eat anything. He wanted to be able to eat. His wife wanted to see her Bobby smile again. And it was just a beautiful...
Is that what she says?
Yeah, that's what she said.
That's nice.
In fact, they're now friends on social media, on Facebook. They take pictures in Anguilla, him smiling ear to ear, way bigger than that photo, and they say, "Thanks for all you did. My Bobby's smiling again." Another patient comes in. He has no teeth, no denture. For him, his only option was to wear a denture, and he had tried. And in fact, somewhere else, they attempted to place mini dental implants. Didn't work for him, not comfortable. He wasn't satisfied. So he was going around trying to find somebody that could do dental implants. He had seen several specialists, and they all said, "You don't have enough bone for this."
But isn't it true? I mean, if you've been wearing a denture for like, 10 or 15 years, you can't do this. You don't have enough bone.
Absolutely not true.
Okay.
We hear that all the time. Every day in my office, a new patient comes in and says, "I was told I don't have enough bone. I was told 10 years ago, 20 years ago, I don't have enough bone." We take a look. I say, "Guess what? There's enough bone. I can do dental implants for you today."
So this is technique driven?
It's definitely...
Is that why you're able to do it and they can't sometimes?
It's definitely technique and experience and training driven.
Okay.
Some people will look at a case and say there's not enough bone there. Oftentimes I can look at the case, same patient, and say, "We can absolutely help you."
So what did you do for him?
Well, where the other doctors said there was not enough bone, we placed implants top and bottom jaw and a brand new smile. Look at this guy. He loves it.
You got to admit, it looks good.
He looks like a movie star. Is there somebody that you recognize
Like a
there?
Michael Douglas kind of a thing.
Exactly, Michael Douglas. We joke around that he's Michael Douglas's stunt double.
What's it like when a guy like this looks at himself in the mirror for the first time?
Oh, man. I mean, you can see it right there in his eyes. You got those pictures. Put those side to side. Look at the difference in his smile. Look at that gleam in his eyes. Look at how big his cheeks are.
He's much more handsome.
Absolutely more handsome and more self-confident. And you know what else? He can finally eat. He can eat anything he wants, which is why he came in the first place, to be able to eat again, to be able to eat foods that he loves. He didn't know he was going to get this great looking smile.
Now, when you're on the console with a guy like this, does your brain go, "This guy is going to be good"?
Oh, I'm like, this is a home run. I mean,
really?
Nobody else, he's been everywhere else. Nobody could treat him. He's got teeth.
You get excited about it.
Oh, I know.
They're telling you their hard luck story, but you're kind of getting excited.
Yeah, I'm looking at him going, "When do you want to do it?" And they're like, 10 years ago. So let me ask you a question, Randy. Do you think that he looks any younger?
Yes, substantially younger.
Maybe a little bit more sophisticated?
That's for sure.
Let me go to another case here. This guy, John, he's become a good friend of mine since we finished treatment. He didn't want to show his before picture. And we get that. A lot of patients, they don't want to go back. They don't even want to see an old picture. They don't want to remember what it used to look like. But I'll tell you, the best way to describe John's teeth before is, kind of like shark teeth. Like there was just a lot of teeth, and they're kind of coming out. And I mean that with all respect for John. But he knows. So just to paint a picture for your audience, well, look at this smile. Look at how big the smile is. And, the reason I wanted to show John is, one, we respect your wishes if you don't want to see your before. But John wrote us a couple testimonials. And I'd like to read those for you now.
All right.
So John says, "Several years ago, after the arrival of my first grandchild, and with the anticipation of more to follow, I decided I wasn't going to be one of those grandpas with zoo breath and wind chiming teeth. In one long day, Dr. Hogan and his friendly professional staff provided me with a lifelong, warm, healthy, and inviting smile that I love sharing with what are now my 4 grandchildren, family, and friends. This is truly life-changing."
Very nice.
John goes on to say something else about his professional life. He says, "As a seasoned heavy construction professional, I'm occasionally tasked with presenting our firm's talents and capabilities to municipal and state review boards for consideration during their deliberations for consult, engineering, and inspection contract awards. My comfort level and confidence during these presentations has increased immensely since Dr. Hogan and his first-class crew performed their transformative work in providing my new forever smile. The heavy lifting was performed on only one day, minimizing my time away from work, and the results have been life-changing on not only a professional level, but in my everyday personal life as well."
Very nice.
Absolutely. It's just, it's profound. And what just brings a tear to my eye and I love about John is successful guy all through his life, marriage, family, career. He never let his teeth get to him. But the way their grandchildren look at you, the memories that they form of you, it's so incredibly important. It might be the most important thing that happens in your entire lifetime. I have another patient.
All right.
Here, similar to John, general contractor, and he has no upper teeth, and he only has a few teeth left on the bottom, and they're decayed and they're rotten. And he came in with his beautiful wife, loving relationship, very supportive of each other. I love their story. And he was looking at just wearing dentures, and he didn't want to wear dentures. He wanted to get back into new teeth. He didn't want to go through that. Look at his after picture. For him, we did upper and lower full set of implants, teeth.
Looks like a friendlier guy in the after.
Absolutely looks like a friendlier guy. In fact, he told me that ever since he did his teeth, he has found himself smiling and cracking jokes to other people around the yard, around the work site. He never talked before because, this is what he has told me, he didn't talk before because he didn't want to draw attention to his mouth. And now that he's got the smile, he says he catches himself in pictures.
You say these patients tell you they feel judged because of their bad teeth. Like they're not clean.
They do. I think they all feel a little self-conscious about the way that they looked before. But the good news is that we can revitalize them. We can change them all in just one day and bring out that person that they always have been, that they haven't been able to show.
Is this a future of dentistry, whether it's 20 years or 100 years, that dentures as we know them will be gone? All teeth will be attached to something. Do you think that?
I absolutely think if we had enough dentists to treat all the denture wearers in this world, there wouldn't be any denture wearers. Dentures are a thing of the past. It's something that you don't have to wear. You can get a brand new set of teeth and never have to take your teeth out of your mouth.
How old can you be to do this? Like, what's your oldest patient?
My oldest patient has been 98 years old.
Why would a 98-year-old want to do this?
Because they want to feel better about themselves. They want to eat the food. They want to eat apples. They want to eat almonds. They want to eat those foods. because they feel young, and they should.
But aren't they more likely to fall out if you're 98 years old?
No, not at all.
So statistically, not the case.
Statistically, it's not the case.
So the age doesn't matter.
Age doesn't matter.
Statistically, if you're over 72 years old, you're on about 4 medications. Can people be on medications and still get this done?
Oh, absolutely. 70 years old is the average patient that we treat, and almost all of them are on 2, 3, 4 or more medications. We'll work with your medical doctor to overcome those hurdles. It's not an obstacle.
Very nice. Time for some more photos.
All right, this one of our younger patients. I call her, she's a Navy corpsman by trade. I walked in, I saw her, she says, socks, water, Motrin, Marine. And I knew right away she was a Navy corpsman because that's what they always told us in the Marine Corps. But she has no back teeth, and she obviously has 6 front teeth, doesn't like her smile. She can't chew, she can't eat because she has no teeth in the back to chew with, and she wants to look and feel better about herself. So in one afternoon, we brought her in, we gave her top and bottom set of teeth.
Looks like cosmetic dentistry, like porcelain veneers.
Everything is cosmetic dentistry. I've got a whole stack of cosmetic dentistry. We don't do anything that's not cosmetic. It's all gorgeous.
So this, like the design, is done on a computer.
Yes.
Is that correct?
Oh, we have a full digital lab. So everything is done. You come in, we do a scan, no impressions. We go back in the design.
What do you mean, like the goopy stuff?
Yeah, that goopy stuff that sticks in your mouth that tastes really bad and it takes forever to set. Sometimes makes people gag a little bit. We don't have to do any of that stuff. We just have a camera, it takes pictures of you, some in the mouth, some out of the mouth.
Okay.
We go to our lab. Our laboratory designers, they design teeth that are fit for the patient's individual face.
And they just maintain them like regular teeth. They come in like every 6 months, get them cleaned, brush them, just like regular teeth.
They come back, they see our hygienist, which is important. Our hygienist has the experience to handle these and maintain these smiles for a lifetime. So when you pick a place, make sure that they not only place the implants and put the teeth in, but make sure that they maintain the teeth.
Is that something you'd want to ask too? Do you have your own in-house lab?
I think that's definitely, you want to ask if they have their own in-house lab. You want to ask, do they have a program to maintain the teeth? And you want to ask, how often do you do this procedure? Because at our office, we do this procedure every single day. Let me show you this next patient.
All right.
Here's a patient. She's missing some front teeth. She's missing some back teeth. She obviously doesn't like the way it looks, but she knows she's going to be going to a denture. She was actually referred to our office by an area specialist for her teeth. We brought her in. In one day, we gave her a complete set of upper teeth, brand new smile. She's now able to eat all the foods that she loves. And most importantly, looking at that before picture, nobody is going to judge her ever again. She looks wonderful. She looks beautiful.
Good point.
Would you say that her eyes look like just a little bit more gleamy, a little bit bigger?
She does. Yeah. She definitely looks happier.
She's definitely happier. And for her, like so many patients, they say, cosmetics aren't important to me. I just want to eat. But when they see the cosmetics and they see what it does for them, opens up their life.
And you say that sometimes they come in and you don't even recognize them because they're acting differently.
Oh, yeah. This has happened numerous times. I'll see somebody walk through the front door. I think it's a new patient, and it's somebody we did surgery on last month. They just now they're doing their hair different, their makeup different, they're dressing different, and it's a positive experience all the way around. Let me show you another patient.
All right.
This gentleman, he worked at the hockey rink where I coached my kids.
Okay.
And he was in the back, and he was I didn't have a lot of interaction with him, but he waited for the time that was right for him to come and see me. He had a partial denture, 2 front teeth. Didn't like the way it looks. Didn't like the way he couldn't eat any foods off his front teeth. You see, that's the best before picture we could get of him smiling. But there's a partial behind there. But look at him after smiling same day. And I promise you, that's not the biggest smile that we're gonna see.
That guy looks young to be wearing a denture. I mean, he would have been wearing a denture possibly?
He would be. He was already wearing a partial denture.
Okay.
And he was in danger of losing the other teeth due to bacterial infections. And so something had to be done. And he didn't want to go into a full denture. So we were able to skip the denture stage and go right to teeth fixed on implants.
So these upper and lower teeth that are supported by implants, can they last if you take care of them as long as you live?
Absolutely, they can last. They
Some
can
people
last.
call them permanent.
Yep.
Can they be permanent?
They can be permanent. 98% of the time, they are permanent teeth. So if you come in, get them maintained, take good care of them, they're going to be there for you.
Very nice.
Let me show you another case. Gentleman comes in, he's got 6 front crowns, he's got a few bottom teeth, he can't eat and can't chew. Again, super successful guy, really nice guy. Doesn't smile much, got a little bit of a grimace there. But again, what we were able to do for him, comes in, one day, implants, new teeth, does not have to wear a partial
Now,
denture.
I'm not trying to side with you on this. People need to know. I'm just asking the questions here. But these look real. And I told you in the green room, I could spot fake teeth walking down the street.
Yeah.
But these look real.
That's our goal.
Because of the computer design.
Everything is deliberate. Gentlemen, ladies, they might want something different. People, I always ask them a question, Randy. I say, do you want the teeth that you once had, or do you want the teeth that you never had?
Okay.
So some people, they have maybe a diastema or a gap, and it's a family tradition, an heirloom, if you will, passed down, and they want that. Or they want...
So you can keep the gap in their front teeth?
We can keep the gap there.
Okay.
We can make your 2 front teeth a little bigger if that's what they used to. We can copy that shape and size. But some people, they say, I never liked my teeth. I want you to do what you think. You're the expert. Do what you think. And we give them this beautiful smile. It's all by design.
Now the technology, your in-house lab, what if they took it away? Because you used to do it the old way, right?
Yeah.
And that's how it's being done about 90% of the time, you said. What if they took all your technology away?
I couldn't do these results with this type of before and after. I mean, with this type of after picture that are all perfect, my main motive for bringing the lab in-house was to get control of the smile and do it faster and do it cheaper for you. So now we're able to design the smile. In the old days, it would take 3, 4, 5 sets of teeth to talk to somebody across the country about what I wanted to be in the next design. Now I just walk into the next room and we just talk about it.
Okay.
And it's done the first, second time done.
Very nice. Is it more women than men or men than women that are doing this?
Oh, I'd say it's about equal. It's about equal men and women. The average age is probably about 50 to 80 years old. Some younger, some in their 20s and 30s, some in their 80s and 90s.
Most of these patients that you're showing me all these photos, you say that they haven't liked their teeth for like 20 plus years.
Oh yeah.
Like they missed out on good years.
Yeah.
In your opinion.
Oh, they've missed out on half of a lifetime in some
Did they
respects.
tell you this?
Oh yeah, it's their number one regret that they didn't start sooner. They just thought that's the way it had to be. I think they don't know how simple it was and how affordable it was to change their life, or they would have done it 10 or 20 years ago.
I like your line. You say the most expensive part of this procedure is what?
The most expensive part of this procedure isn't the teeth themselves, it's your lifestyle after you get the teeth. It's going out to eat in restaurants, it's taking trips, spending more money, but living your life and just being able to enjoy your life now while you're young.
It sounds like a bit of an exaggeration. You know, when I hear that it's just teeth. But it's like those commercials where I see the guy, they get the new hair and they're swimming and hiking and dating. It's the same kind of thing with this?
Let me show you.
Okay.
I'm going to go back to the back of the pile here. I think she's in the back. All right. It's just teeth, you say. Okay. Here's a before picture, okay? Upper denture, that's not very attractive. The denture itself is what I'm talking about. Lower teeth, she knows she's going to lose all of her lower teeth. She wants to be able to eat again. She might tell you that she was in her apartment every day after work and never went out of her house. Never dated, rarely saw friends, didn't do anything, didn't take trips. Brand new set of teeth. Put those two pictures side by side, Randy.
Wow.
Look at the difference. I'll tell you, she shared one more picture with me. I want you to put this up on the screen.
Okay,
You talk
okay.
about how this can change your life. Never left her apartment.
Like a model now.
Didn't go out. We saw these on Facebook. She's hiring photographers, taking professional pictures on the beach, in the woods with her dog. She's taking trips. She's taking cruises, just grinning ear to ear and going out of her apartment.
Looks great. Now we're short on time.
Okay. Can I just show you a couple more?
Okay. I'll rush you a little bit.
All right. Look at this lady. She's a special patient. She had been to 2 or 3 other offices over 5 years. Upper denture, lower teeth. She knew she was going to lose them. And look what we were able to do for her in just one day. Now, Randy,
Very
wouldn't
nice.
you say she's smiling just a little bit bigger?
Yes.
You know what she regrets?
What?
Not finding our office sooner. She
Very
said,
nice.
"How long you been here?" I said, 20 years. She says, "I could have done it here the whole time." Here's another one.
All right.
Before picture.
And these are all people that would have been in a denture.
Oh, absolutely.
Okay,
There's
okay.
bacterial infection here. She's going to lose her teeth. She knows it. Look at the transformation. Not
nice.
just a smile.
Very nice.
It's a whole look. It's her whole hair. It's everything. And here's another one, upper and lower teeth. This guy is a quiet guy, very reserved, professional.
I mean, is this just for the photo, or he walked around with no teeth like this?
I think he walked around with no teeth like that. Yeah.
Okay,
Yeah,
okay.
he had tried dentures, but he wasn't having any luck with dentures. But here, one day, we were able to change his life. And you know what he turned? The quiet guy. He turns to me one day in the chair and he just says, "Thank you." He whispers, "Thank you."
That's nice.
Completely changed my life. He might have said something like, "I never talked before. I never came out of my shell." And then I started talking to people and smiling at them. And my coworkers said, "You know, you're a really nice guy." They had no idea all those years. He is the sweetest, most humble, nicest guy in the world. But it took having a smile to bring that out so that the rest of the world could appreciate that. All right, let me show you one last one.
Okay, last one.
Okay, here's our before picture. Her name is Bonita, and she is beautiful. Now, Bonita, we're gonna get her after picture. Take a look. Now her after picture. Now listen, I brought this here on purpose. I know that my photographer overexposed those teeth just a little bit.
Okay.
But it's not about the teeth. It's about the rest of the face. Do you see the difference in her eyes?
I
And
do.
her cheeks and the way it all lights up? This isn't about teeth. As soon as we showed her new smile, man, she started posing. I'm gonna ask you to put these babies up. She started posing. It's not about the teeth. It's about that confidence. It's about that look. And now Bonita really is Bonita all the way through and through.
So no more dentures.
No more dentures.
Now, we're completely out of time. Final message to somebody that's watching this, and they've heard what you have to say. They're either wearing a denture, or they're headed to a denture, really bad teeth and gums, but they're skeptical or afraid. What do you say to them?
I say give us a call. Come in for a no obligation consultation, find out your options, meet our wonderful staff, find out what we can do for you. You know, the only regret you're ever going to have is that step that you don't take. You've got to come find out your options. Don't wait another 10 years.
Very nice. Well, I want to thank you for coming on the show. If they want to make an appointment, do they just go to the website, make an appointment, or just call you?
You can just call our office, or you can go online on the website, social media, send us a message. We're available numerous different ways. We're here for you.
All right, Dr. Hogan, thank you for coming on the show. Great stuff.
Thank you very much for having me, Randy.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.